I'm Amy Salisbury. I'm a professor and the Associate Dean for Research in the BCU School of Nursing. Nursing research is about making sure that we have great patient outcomes, whether it's from the activities that we do as nurses to create a safe space for a patient to heal in, or if it's in treatment or interventions that we provide. I started out my nursing career in neurology and then quickly went to psychiatry and ended up working with children who were pretty severely affected by both psychiatric issues and developmental conditions. And I often felt very frustrated because the treatments and interventions that we had were either not effective or were very slow. So I really wanted to be able to conduct my own research so I could figure out better ways of helping our families. My long-term goal was that maybe if we can treat mom effectively during the pregnancy, the outcomes for the baby would be better and we would prevent mental health conditions. So my work now is really focused on bringing that to the next level. So my ultrasound program, we were looking at the ultrasound that I used for years to be able to measure the fetal neurobehavior. Moms, when they would come in, whether they were depressed or not, would become very joyous at seeing their baby on the screen. And so we use that in our Nexus program to be able to show women their fetuses while they're feeling the baby move inside, and that creates a connection from her to the baby. And at the same time, we're offering them some motivational interviewing where we're focusing on positive things, behaviors that they do to take care of themselves so that we can make their outcomes better, and hopefully for the baby too. The work I do with the ultrasound we're bringing to the community because we've had such a positive response to it, and we really want to make it accessible, and we're hoping to make it part of standard of care for women that are high risk, that this type of interaction using the ultrasound can be part of their standard ultrasound during prenatal care, helping women to actually seek prenatal care and to stay in that care. And we're trying to develop a specialty community engaged clinic where we're bringing both obstetric care, screening, especially with ultrasound, using the Nexus format of motivational interviewing and education while they're seeing their baby, but also integrating mental health treatment and even substance use care right there at the site. And what we've heard from our participants when we do interviews at the end is that people have really felt respected. They felt like they weren't judged coming into our program, and that has made them feel positive about themselves. And they've attributed that to some of the reason why they got into treatment for substance use.